Hi, it's Rachel from Toward Wellbeing again. Today I just really wanted to quickly touch on how to notice changes in family and friends. So one of the biggest things that people are worried about when they ask family and friends, how are you doing? Are you okay? Is what are they gonna say in return? What if they say, no, I'm not okay? So sometimes it stops us from actually asking that question. And sometimes the biggest fear is, okay, what next if they do say no? So first of all, be really attuned with your family and friends, your loved ones. I think it's really important that you pay attention to what is normal behavior and starting to notice if things are not kind of aligning with who they generally are. Are they flatter than usual? Are they quicker to anger or get to frustration more than usual? Are they more teary or down? So what you might notice in your friends is lack of engagement. Maybe they're saying no to things more often and hiding away. Or you might notice other changes in their behavior, like not particularly adaptive coping strategies, so drinking more or going out and using other distractions. So I think it's really important that if you notice those things, it's not an accusatory question, it's a genuine, are you okay? But also being willing to sit with them and help them if they say, no, I'm not okay. So where do you go from this point if somebody says, well, no, I'm not okay? The biggest fear that we think about in society and just in general is that extreme of I'm not okay, which might be ending their life or contemplating suicide or self-harm. And by asking about those questions or by talking about it, you are not increasing that risk. You're giving them an avenue to talk to someone and to give them, your trust that you are there, that you understand and that you're willing to support them. That is massive. That is not going to increase their risk. But if somebody does tell you that, in Perth, you can call a number, the Mental Health Emergency Response Line. If you're concerned about somebody's health, you can also contact Lifeline. It's also really important to link people back in if they're already associated with a mental health professional or health professional, like a psychologist, a counsellor, their GP. And just be really present. You don't have to try and fix it, and I'm sure that your loved one wouldn't expect you to. So you're not trying to fix things, but just genuinely listening, hearing what they have to say, reflecting back feeling, reflecting back your acknowledgement of how tough things are right now. And you'll be surprised how far that, along with some pointers in those right directions of support services, can go a really long way. Tune in for the next video.